Everybody, Dr. Rob Silverman here. How are you today? Hope all is well. Hope you had a great weekend. Was away, had some things to do, got a lot of good writing done towards my book, and gave me an extra day on Monday. Everybody asked where I was, and everybody asked, could you talk a little bit more about intermittent fasting? And without question, intermittent fasting has been taking the world by storm. Fasting, long-standing fasting, time-restricted eating has taken the world by storm over the last 2 years. And you're going to hear a lot today about how to intermittent fast, what is it, and all the positives that go with cognitive ability, weight loss, gut health, brain health, and more. So everybody, please share this right now. If you're listening live, do me a favor and share this with everybody. This is the intermittent fasting live that you want to hear. And feel free to ask questions. I know it's at a Tuesday at 1 o'clock, but ask some questions. Let's engage. I'm going to engage everybody. So like it, comment, and share it. So let's get into the idea of intermittent fasting and intermittent fasting for what I like to refer to as some different nutritional protocols. It is without question a functional nutrition approach. Big takeaway. High-hanging fruit, not low-hanging fruit, is if you just add intermittent fasting to your armamentarium, you're going to get health benefits, you're going to lose weight, you're going to have changes in blood sugar, you're going to have changes in blood profiles and cholesterol. So the first thing I really want to share is Dr. Vlada Longo, because he's done a lot of research and he's really brought this back to the top, if you will. He's kind of the capstone, if you will, of intermittent fasting. In that, he's really a fast mimicking diet. His quote, good book, Longevity Diet, I do recommend it, awaken the body's dormant ability to heal, protect, regenerate, and rejuvenate itself. He spoke to that idea of the idea in fasting. So fasting is without question at the top of the mind. You guys can all hear probably right now, we've got a huge storm here in New York. Lights went out before we went on. So if you hear the noise, it's all good. Just some sound effects for you. Once again, Vlada Longo, Longevity Diet Superstar. What's most interesting about fasting is, hey, did you hear about this new thing, intermittent fasting? Have you tried it? And the real fact remains is fasting has been an integral part of human health diet, which we recently lost and rediscovered. So when you go all the way back, fasting was really sustained by major religions over durations of thousands of years. However, over the last 50 years, fasting was replaced by patterns of uninterrupted daily food intake. I was just having a conversation with a friend over the weekend. It was my wife's birthday, and we were talking, and he says to me, you no longer eat 5-6 meals every 2 hours anymore, do you? And I'm like, no. That was fashionable, but that really doesn't work, and doesn't work to the extent that we want health, believe it or not. That is the antithesis of what we want to do now. We want to eat in a window, a small window. We want to rest because, believe it or not, when our body is not feeding, it's fasting, all the health benefits come. You want to feed in a short period of time, and when you feed, you want to feed with good nutrients. So let's see how much fasting has come to the forefront of the American consciousness. In 2008, it was without question rated as the #1 diet pattern for the U.S. in 2018. It dropped in 2019 to #2. And now, since we've broken up intermittent fasting in a multitude of different terms, fasting is still in the top 5. Forbes.com and all other journals rate intermittent fasting quite high. And literature is coming out at a very abundant rate to really speak to the idea of incorporating intermittent fasting. The first article that I want to talk about was in December of 2019, the end of last year. It was in the very reputable, prestigious New England Journal of Medicine. Their takeaways were very simple, as follows. Number one, during intermittent fasting, ketogenesis occurred. So you don't have to try a ketogenic diet to get ketogenesis. Intermittent fasting can provide ketogenesis because you're eating in such a small framework. Now, obviously, if I were to segue and talk about the ketogenic diet in conjunction with intermittent fasting, that would be a really good sweet spot. And they do work very synergistically. We've done a recent Facebook Live on that. If you have any questions, I think it was about 2 weeks ago. You can take a look at that. In addition, So the takeaway from the New England Journal of Medicine was very simple. There was a decrease in free radical production, which is great. Free radicals, when released, obviously radical and free, are damaging. A decrease shows that your body isn't rusting from inside as profusely as if you were eating all the time, or as I used as an example, that 5 to 6 meal a day every 2 to 3 hour period. New England Journal of Medicine also indicated that there was weight loss via intermittent fasting. The cellular responses were stellar. Increased glucose regulation. As we all know, glucose is blood sugar. That's a critical element, especially when you talk about overall health, body composition, and inflammation. It also showed an increase in stress resistance, and ultimately, intermittent fasting suppressed the bad guy, inflammation. And we all know that inflammation is a critical element because we're talking about, for the last 6 or 7 months, high inflammation, or if you will, cytokine storm or cytokine storm syndrome. Because intermittent fasting produces ketogenesis, we get ketone bodies. Now, ketone bodies are excellent because they're pleiotropic in that they do 2 specific things. They work 2 different pathways. The big ketone body is beta hydroxybutyrate. It's an uncoupling protein, and it's really shown to be great fuel during fasting. It's great brain fuel. And it also, these ketone bodies are potential signaling molecules with major effects on any kind of cell and organ function. As we get a little more involved and a little deeper into the article, which they published again last year, the clinical applications were vast. Obesity and diabetes type 2 were able to be, obviously obesity was decreased and diabetes type 2. I won't use the word ameliorated, but again, the incidence of diabetes type 2 was distinctly or precipitously decreased. Cardiovascular disease, the indicators, there was tremendous improvement in these cardiovascular disease indicators like blood pressure and resting heart rate. Also, levels of HDL were increased, whereas the LDL, the bad guys, were decreased. Overall cholesterol was decreased. Triglycerides, blood fat was decreased. Glucose was decreased. Insulin and insulin resistance, a huge marker. Anytime anybody listening to this goes to the doctor and they do not test for insulin resistance, ask for another blood test. It's a critical blood test. It really shows, to me, one of the critical markers for inflammation in the body. Some other decreased markers were systemic inflammation. As everybody knows, my mantra is to manage and modulate inflammation, control it, decrease it, and hopefully allow it to be resolved. Oxidative stress also was decreased. Both of those markers were in relation to atherosclerosis, plaquing. Heart rate variability was also improved, and heart rate variability for me shows that there's an increase in parasympathetic tone. That increase in parasympathetic tone is critical because the more that heart rate variability increases, not heartbeat speed, but the variability in which the heart beats, shows a great health marker. There was a decrease in neurodegenerative disorders. Asthma, multiple sclerosis, arthritis, and surgical tissue injury were also decreased. So before we get into the idea of intermittent fasting for weight loss, I keep using the term intermittent fasting. I've talked about some intermittent fasting previously, just want to make a good definition. Intermittent fasting is used in the parlance now, but truly intermittent fasting means taking a day off from eating or 1 to 3 days during the week. What we're really referring to is time-restrictive eating or time-restrictive feeding. Time-restrictive eating means that you're going to fast within a window during a day and eat within a window. So 16 and 8. The first number shows that you're going to fast during the day. So 16 means you're not going to eat for 16 hours, including sleep. And 8 shows that that's when you're going to feed. Fast is the first one. Feed is the second. So we truly call it time-restrictive eating. Now, in this study that just came out on July 15th, 2020, intermittent fasting was shown to aid in weight loss. It was an 8-week trial in which they enlisted 58 men and women that were assigned to 3 specific groups. Group number 1 did the time-restrictive eating between 3 and 7 hours. Group number 2 did time-restrictive eating between 1 and 7 hours. So basically, time-restrictive eating ate between 3 and 7 p.m. Group 1, Group 2 was 1 and 7 p.m. So obviously, they were eating in a 4 and a 6 hour period, respectively. They ate whatever they wanted. They did not do the Dr. Rob diet. They ate what they wanted. Group number 3 ate without restrictions. So let's look at the results. Group 1 and 2 consumed 550 fewer calories than the control group. of course, eat in a smaller period of time, there's going to be some caloric restriction. And they also lost 3% of body weight. When they compared with the control groups, both groups showed a significant decrease in fat mass, a reduction in oxidative stress, a decrease in fasting insulin levels, and of course, a decrease in insulin resistance. So for me, that 4 and 6 hour period looks good. I like 16 and 8, 14 and 10. I understand that people have a tough time. They're not able to sometimes get all the food they need in 4 or 6 hours. Their jobs are hard. So for me, 16 and 8, 14 and 10, if you really want to push it, is excellent. But notice what they said. All health markers, they eat a little less, they eat in a shorter period of time, but they eat whatever they want. I mean, they could have had pizza. Which obviously pizza has cheese, it has gluten, it's dairy, it's gluten and all that kind of stuff, not a choice food. However, imagine if you get that 8 to 10 hour window in which you eat, and I'm directing you, you're going to get the outcomes that you want. It shows improvement. I was having, again, conversation with the same friend, if I can use it as an analogy, if you will, metaphor. And he was saying how he's doing this detox. Well, he's really not doing detox, but what he's doing isn't the best thing, but it's better than what he was doing before. But are you optimizing? So the intermittent fasting, 4 and 6 hours, eating what you want, is better than what you did before. That was proven in the literature. That was proven in objective blood tests. But are you optimizing? And that's the critical element. If you're going to put some effort, let's optimize. So obviously, let's eat in that 6 to 8 hour window, but eat good, healthy foods. Another study that I wanted to share was the effect of daily fasting on shaping the gut microbiota in mice, because I'm all about the gut, because 80% of your immune cells are in the gut. It's where your macro and micronutrients are absorbed. So intermittent fasting did shape the gut microbiota in daily fasting dependent manner. The magnitude of fasting was observed to be optimum eating in an 8 hour period. So many people come in with gas and bloating, IBD, all different issues, gut issues, having trouble losing weight. And we found out that intermittent fasting is a staple in the armamentarium that I use to help them get over the hump and heal. No matter what dietary changes I make, I always mix it with the intermittent fasting, time restrictive eating, and so on and so forth. So intermittent fasting and gut microbiota, another study came out in December of 2019, and it really showed that intermittent fasting promoted white adipose browning. Now, brown adipose tissue is metabolic, so not all fat is bad for you. That enabled decreased obesity by changing the gut microbiota, in addition to the adipose browning. The alterations of the gut microbiota in the fasting group induced that beige, that browning formation of the fat. And lastly, gut microbiota fermentation products such as acetate and lactate increased during fasting. So what does that mean? Intermittent fasting allowed the production of what we call short-chain fatty acids. Short-chain fatty acids give a very salubrious, health-promoting milieu in the gut. So by intermittent fasting, I didn't have to supplement to give them short-chain fatty acids. Now imagine if you were giving a probiotic and doing specific things to help the microenvironment in the gut, you would have, without question, a great health outcome, leading you down optimization of health properties. So in a nutshell, as I like to say, or the bottom line, intermittent fasting benefits for gut health. Gut health matters. Why and how does it really matter? 80% of your immune cells are in your gut. It's where your digestion occurs. It is a critical element, because if you can't digest, you're going to eat more. If you're going to eat more, you're going to get heavier. You're going to eat in excess calories. Although I will say, it's all about chemicals and not about calories. However, you want to absorb good nutrient calories, because if you're able to absorb them, you get a sensation of feeling of fullness, which is satiety. In addition to that, the circadian rhythm plays a critical role. So your circadian rhythm is your matching with the sun setting and the sun rising. So I'm in the East Coast. Funny things happen when you travel. Now, for me, if I go West Coast, that 1 hour to Central, 2 hours to Mountain, and 3 hours to Pacific doesn't bother me that much. If I go forward, like when I go to Europe, that's when I get the bejeevers knocked out of me. But you have to try and work within your circadian rhythm. So people who travel, you can't be eating at all different times. You best suggestion is always to eat and stay within your own circadian rhythm and where you live and what you're most used to. You want to give yourself a break. That's one of the great things about intermittent fasting, time restrictive eating. You want to give your digestive system a break. It's really shown to be health promoting. You clear out and you're migrating motor complex, which is a critical element, leading you down a path of health, not getting backed up and slowing down, which can promote deleterious conditions like SIBO, small intestinal bacterial overgrowth. You don't want your digestive system to work all the time. You want it to work in a shorter period of time. And by the way, intermittent fasting, time restrictive eating is a great way to improve gut health. So the bottom line is, if you want overall health and good gut health, intermittent fasting, time restrictive eating is something that you want to include in your pattern of daily living. So something a little heady, if you will, fasting, leads towards something called autophagy. Autophagy is your body's own cellular process of eating cells. The cells go away and you get new, healthy, rejuvenated cells. Autophagy won a 2016 Nobel Prize. We're talking about that a lot right now because when we get rid of the old cells and we get new cells, we call that immunorejuvenation. So these new cells look like grapes bursting with energy, where the old cells were raisins, we're getting rid of them. So the ability to have autophagy, and you can increase autophagy by intermittent fasting. When you couple the autophagy by also stimulating a pathway called AMPK, AMPK does autophagy, and AMPK, this is the first time I've talked about it, everybody please make note, leads to mitophagy. Mitophagy is the breakdown of mitochondria to allow yourself to get new mitochondria, powerhouse of the cell, what we call biogenesis or mitochondrial biogenesis. So we found out that when you're able to do this, and intermittent fasting stimulates both autophagy and mitophagy, mitophagy enables you to decrease the aging process. It's all about mitochondria and mitochondrial cellular function. So let's review the benefits of time-restrictive eating. It induces autophagy. We just talked a lot about autophagy, your ability to break down old cells and eat new cells. It improves your circadian rhythm. It locks you in where you're eating. It promotes longevity. It shows that you're not only going to be healthier, you just may live longer also. It also improves cognition, has a great benefit to heart, to brain health. One of the reasons it helps the brain because it makes ketone bodies. Ketone bodies are a great fuel. Another reason that it's great for cognitive is that it strengthens the gut. The gut-to-brain axis is critical. I call the gut-to-brain axis not only bidirectional, but gut-to-brain axis, I also like to call it a romance. When things are harmonious, there's nothing better. When there's a fight between the two, you got to patch it up and fix it up. You can't just let it lie, just like in a romance. Otherwise, it just festers and things build up and everything starts to break down. It increases insulin sensitivity by decreasing insulin resistance, and it promotes weight loss. And lastly, just what we talked about, it promotes gut health. So there was a great study in Nutrients in 2019. It talked about fasting, intermittent fasting as a therapy in neurological disease. This was a breakthrough study, and in fasting, it showed that it increased what we said before, beta-hydroxybutyrate, brain-derived neurotrophic factors. Brain-derived neurotrophic factors allow for brain neurogenesis. It means that nerves in the brain can grow back. That was sort of documented in 1992 literature, but in 2013, down came the anvil. Everybody agreed BDNF enabled you to have brain neurogenesis. A great choice post-concussion. BDNF comes from the gut, goes to the brain. And we just talked about it before. It also stimulates the AMPK pathway that has a plethora of different properties and stimulation of health-promoting pathways. It also increases adipopectin, which allows women to lose weight, and increases ghrelin, while decreasing glucose, insulin, mTOR pathways. mTOR pathways are these protein synthesis pathways that have been implicated on some cancer cells growing. It also decreases leptin, and check this out. It decreases interleukin-6, the really bad cytokine, and TNF-alpha, ultimately giving you positive outcomes because of optimized neuronal biogenesis, optimized neuroplasticity and neurogenesis, and optimized neuronal resistance. Works with neurological diseases. So that was a 2019 study in Nutrients. Everybody can check that out. Having said all that, what a great ad when I'm dealing with chiropractic patients in my office or somebody who's out there. Now, if you have any questions about this, I know it's towards the end of the video. Feel free to reach out. You can DM me. You can make mention. I'm not done. So anybody have any questions, feel free to reach out. Some of the things we were talking about before, like who shouldn't fast. So let me give you a list of people who shouldn't fast. Pregnant and breastfeeding women, children, anybody who has a history of eating disorder, underweight patients, because you will lose some weight. So somebody whose BMI, if you will, is under 20. Those suffering from heart problems or high blood pressure, and anybody with an adrenal or tremendous blood sugar imbalances. And, I'll be honest with you, I think the blood sugar imbalances do really well with intermittent fasting. So before I get to the case study, I see a question. Was it just that one question? Hey, Gene, how are you? Great to see you. Let me hit you with a like. I'm looking at the questions section right now. And Gene asked, I've been told that intermittent fasting is really just skipping meals. How's that different? No, it's not really skipping meals. I can understand why people explain that. It's eating your meals in a short period of time. It's eating within the window. I don't want you to skip a meal because you may eat breakfast and then you may wait for dinner. So for me, if you're going to do 8 a.m. to 4 p.m., that's that 8-hour window. My suggestion is breakfast at 8, lunch at 12, finish up with dinner at 4. Done. So you're not skipping any meals. You are eating meals. We want you to eat. You need nutrients. You may eat 2 meals. The problem is, here in America, we're a little corpulent because we eat too much. We eat too many hidden calories. We eat that high fructose corn syrup, etc. So we're eating too many meals. We're eating too much crap. So I think that, we got another question. Let me see if I can get down to it. Yeah, we don't like BMI. May said we don't like BMI. That was something that was used on that list. Body mass index, it's height over weight. We like what we use in the office is we use an in-body test. So we do body fat. We'll do quadrant testing. We'll body composition. Thank you. And we'll also do visceral fat. And visceral fat's critical because that's the fat over your viscera, and that's where most of the inflammation is. One quick case study before I leave you. Just had a patient give me a call back. We've been working with them for 2 months. And they were a little strapped to do any kind of supplementation, and they were a little strapped for a lot of the blood tests that we like to do. So I just changed the person's diet. I took away the gluten, the processed food, the sugar, no dairy, no nicotine, no artificial sweetener. Had them eat in an 8-hour period. Just so you know, the person's a female, 5'4", 172 pounds, with 41% body fat. 2 months later, she's down to 31% body fat, and she's already lost 17 pounds. Her energy levels off the chart. She feels great. Skin's changing. She looks 5 years younger. So just some subtle changes in a 2-month period, which is a very short period of time, is life-changing, life-saving changes. Again, if you have any questions, feel free to reach out. Please do me a favor, like it, click it, share it. I know we were on a Tuesday. Normally we get Monday. We had a little trouble with the internet yesterday, but I'm always here for you. And, I always say this. A good friend of mine reached out to me, and he says it's one of the more poignant points that I give. I know in this time period, a lot of people don't know who to listen to, who to trust. So you can trust me because it's all about your health. I'm here for you. It's what I've been doing for 21 years and continue to do, hopefully, for the next 51 years. So everybody have a great day. Dr. Rob, always yours.